Welcome back to Pass Your Class Dante's DSST Test Prep. Today I'm excited to work through some authentic lifespan developmental psychology DSST exam practice questions with you. Pass Your Class has been the trusted partner for students pursuing college credit through Dante's examinations for over a decade. We're excited to consistently achieve our remarkable 98% success rate among students who utilize our comprehensive study materials. In our session today, we'll tackle challenging developmental psychology questions covering prenatal development hazards, moral reasoning stages, and cognitive development impacts on children's understanding. These crucial topics help explain how humans grow and change throughout their lives. Let's begin our developmental psychology exploration. Which of the following is a teratogen? A. Alcohol. B. Tobacco. C. HIV. D. All of the above. The correct answer is D. All of the above. Teratogens are environmental agents that can cause birth defects or developmental abnormalities in an unborn child during pregnancy. All three substances mentioned, alcohol, tobacco, and HIV, are well-documented teratogens that can significantly impact fetal development. Alcohol consumption during pregnancy can lead to fetal alcohol spectrum disorders, causing facial abnormalities, growth deficiencies, and cognitive impairments. Tobacco use introduces harmful chemicals that can result in low birth weight, premature birth, and increased risk of sudden infant death syndrome. HIV infection can be transmitted from mother to child during pregnancy, birth, or breastfeeding, potentially causing severe immune system complications. The effects of teratogen exposure are often unpredictable and can vary dramatically depending on factors like the timing of exposure during pregnancy, the dosage or intensity of exposure, and individual genetic susceptibility. Understanding teratogens is crucial for prenatal care because many developmental problems can be prevented through proper education and medical guidance during pregnancy. In which stage of Kohlberg's theory of moral development is one concerned with avoiding punishment? A. Preoperational. B. Preconventional. C. Postconventional. D. Conventional. The correct answer is B. Preconventional. Lawrence Kohlberg's theory of moral development describes how individuals progress through different levels of moral reasoning throughout their lives. The preconventional level represents the earliest and most basic form of moral thinking, typically found in young children, but sometimes persisting into adulthood. At this level, moral decisions are based primarily on avoiding punishment and seeking rewards rather than on internalized moral principles. The preconventional level consists of two stages. Stage 1 focuses on punishment avoidance, where individuals determine right and wrong based solely on whether an action will result in punishment. Stage 2 involves instrumental purpose, where moral decisions are made based on personal benefit or reward. This contrasts with the conventional level, where moral reasoning is based on social approval and maintaining social order. And the post-conventional level, where individuals develop universal ethical principles that guide their moral decisions regardless of social expectations or personal consequences. At what stage of development will children believe that the divorce of a parent is their fault due to egocentrism? A. Sensorimotor. B. Preoperational. C. Concrete operational. D. Formal operations. The correct answer is A. Sensorimotor. According to Jean Piaget's theory of cognitive development, egocentrism during the sensorimotor stage can lead children to believe that major family events like divorce are somehow caused by their own actions or thoughts. During this earliest stage of cognitive development, which typically occurs from birth to approximately 2 years old, children have difficulty distinguishing between themselves and their environment. This leads to an egocentric worldview where they see themselves as the center of all activity. This egocentric thinking can cause very young children to assume that significant events in their family, including parental conflict or divorce, must somehow be related to their own behavior. They may believe that their crying, misbehavior, or presence somehow caused their parents' problems. This self-blame is particularly concerning because children at this developmental stage lack the cognitive sophistication to understand the complex adult issues that actually lead to divorce. Understanding this developmental characteristic helps parents and caregivers provide appropriate reassurance and age-appropriate explanations to help children cope with family transitions. Outstanding work completing these lifespan developmental psychology DANTES practice questions. You've just explored critical concepts that demonstrate how biological, cognitive, and social factors influence human development from conception through childhood. These questions offer just a glimpse of the extensive developmental content covered on the actual DSST examination. For thorough preparation encompassing all major areas, including prenatal and infant development, childhood and adolescent growth, adult development and aging, cognitive and social development theories, personality development, and developmental disorders, PassYourClass provides complete study guides. These guides feature extensive practice questions, developmental theories, and research findings to help you understand the complex processes of human growth and change across the entire lifespan. Head over to PassYourClass.com today to access your lifespan developmental psychology DANTES DSST study materials and become part of our successful community, where 98% of students pass their DSST exams using our proven preparation resources. Thanks for exploring developmental psychology with us today, and we're confident you'll achieve excellent results on your DANTES examination.